Good morning, everyone. My name is Liam Lowney. I'm the Executive Director of MOVA. Nice to be with you this morning. Thank you for joining us with us to talk about some of our plans to attempt to mitigate the anticipated cuts from VOCA. I'm joined today with Stephanie McCarthy, who's our Director of Policy and Legislative Affairs at MOVA. Stephanie and I are going to try to walk you through a little bit about where we are with VOCA and what it is we're going to try to do with the American Rescue Plan Act, like I said, to mitigate those cuts. A few housekeeping items. This is a recorded session, so we just want you to know that and be aware of that. This is called Zoom webinar, so please use the chat function to communicate with us. Any questions you have, or if you have tech issues, feel free to send them in the chat, and Brenna Chase, who isn't seen but is absolutely making sure this happens in the background, can try to assist you. If you have questions, feel free to put those in the chat. We're going to do our best in the time that we have. We have about an hour allotted to answer questions that you have in real time. There may be questions we can't answer, but we will answer them after the webinar. If your question is specific to your program and funding for your program for any of our wonderful partners that have VOCA funding in your program, we're not going to be able to answer questions specific to your program right now. We're working through all those details, although I fully understand why you want answers for what's going to happen next year. Today is really about how a plan we have and with ARPA to try to mitigate the VOCA cuts that are coming. And we want you to be aware of that so we can potentially work together on achieving it. So with that, I'm going to turn it over to Stephanie because we're talking about the American Rescue Plan Act. We want to start with what is that? And then I will talk a little bit about MOVA's request for those dollars. Stephanie?
Thanks, Liam. Good morning, everybody. Thank you for taking the time to join us this morning on certainly a busy day across the state and another busy week post-summer. So we really appreciate you joining us for this discussion. So, the bulk of what we're going to be talking about today is the American Rescue Plan Act. So wanted to first kind of zoom out to provide some context to really what the American Rescue Plan Act is, what its focus is, and how that will work out in Massachusetts. So the American Rescue Plan Act, also known as ARPA, is the $1.9 trillion relief package that was passed by Congress and signed by President Biden on March 11th, 2021. So through this bill, each state received an allocation of flexible spending to address a few different categories of needs related to COVID-19, premium pay to eligible essential employees, to provide certain government services impacted by COVID-19 losses, and to make necessary improvements to water, sewer, and broadband infrastructures. So relatively wide parameters of the bill. But through this formula, about $5.3 billion was available for spending in Massachusetts. And I want to highlight that when we're talking about this $5.3 billion, this is separate from the specific set-aside funding that was included in ARPA for specific victim services needs. So that includes your FIPSPA, your Child Abuse Prevention Act dollars, and the culturally specific domestic violence and sexual assault services dollars. So when we're talking about our request for ARPA funding, it's in addition to these victim service funding that has already been included in the bill. So in Massachusetts, to kind of narrow in a little bit, if anybody was paying attention over the summer, there was some debate between the governor's office and the legislature and who had the authority to spend the money. Every state is handling this differently, and we've been kind of trying to track across the states that receive VOCA funding on what their process is, but ultimately in Massachusetts, the legislature was deemed to have the jurisdiction. So the governor was authorized to spend a small portion of that 5.3 on some emergency needs and within communities around the state that did not benefit from the federal municipal formula. And that leaves about 4.89 billion of that 5.3 that's now being swept into a fund controlled by the legislature. So the legislature has now begun a traditional legislative process, which includes input from legislators, stakeholders, programs, individuals like MOVA, like yourselves, like your programs, to figure out how to best utilize this money. There will be engagement opportunities throughout this process, and we'll talk a little bit about that later on through this webinar. But the Ways and Means committees have already begun public hearings. There's been 3 so far, and we anticipate about 2 or 3 more through the end of this month and early October. So programs will have the opportunity to support funding initiatives that would make sense for the use of ARPA dollars. And the life of the grant is through 2025. So there are a few years for these funds to be dedicated. That's part of the reason that we're one of the few states that have not spent the money immediately. But based on the comments from Speaker Mariano yesterday, there is a desire to pass a bill before Thanksgiving. So while the timeline is a little bit up in the air, we are moving forward kind of all hands on deck over the next couple months on not only making sure that our legislators are informed about the need in Massachusetts for victim services to be maintained at their current levels, but also that our programs have the opportunity to participate in that process if they wish to do so or have the ability to do so. So with that, I will pass back to Liam to kind of get into the weeds about what we are looking for specifically for MOVA to utilize ARPA funding to mitigate the VOCA reductions.
Thanks, Stephanie. So what we're really trying to do is look for ARPA dollars to stabilize and support crime victim services in Massachusetts. Our request to the legislature, and we've had a couple meetings with House and Senate Ways and Means and some of the other folks over at the legislature. Our request is about $70 million, which includes a 2-pronged approach to better serve all victims of crime in Massachusetts. First and foremost, we're trying to mitigate VOCA reductions with this supplemental state funding. As many of you know, and I know many of you joined our webinar in April where we talked about the VOCA cuts, and I thank you for joining us in that webinar. Just as a side, we're trying to use these webinars to more effectively share with you what's going on and what we're doing. So hopefully this is helpful to you. But just for a little refresher, the VOCA grant awards that are administered by MOVA have steadily declined since federal fiscal year 2018. And those mirror the reductions that were in the Crime Victims Fund nationally. And this is all occurring at the same time that the demand for services has increased. And I know I don't need to tell you all that. Massachusetts FY21 award is at a 5-year low. It's approximately 35% less than the previous year, which means that there is less funding to support services for crime victims as the need has increased and shifted as a result of the COVID-19 pandemic. And I know all too well from talking to so many of you how you've shifted your work, had to shift your work during the COVID-19 pandemic over the past year. And in many ways that obviously put more strains and costs on your programs. And we also know the increased use of technology has also increased access by crime victims to your programs. And now as the state has opened up, now it's almost like you're expected to work in both paths, not going back totally only to the way we delivered services very in-person focused in the past, but doing that as well as needing the staff who can sit behind a computer and work with someone over the computer. So long and short of it is you're flexible. We appreciate that. And that costs something and it costs more. But this is happening at the same time that VOCA funding has gone down. And we know that those reduced available dollars will impact services to crime victims of all types of crime, including the CACs, our sexual assault programs, domestic violence programs, homicide bereavement programs, the legal assistance programs, elder abuse programs. All of you, I know, are facing new challenges, new costs, and this is going to impact everybody. We were very excited to pass the VOCA fix in July. For those of you that have been following that, we're really grateful to the folks in our delegation from Massachusetts, as well as down in the Senate and the House in DC for passing the VOCA fix. It was very exciting to have President Biden sign that bill on July 22nd. As we've talked about in the past, the VOCA fix is intended to shore up the way funds go into the Crime Victims Fund so we don't find ourselves in this position again, where we see decreases coming to all 50 states, 5 territories, and DC in the future. However, fix does not immediately impact the reduced funding that we have in the last 3 years of VOCA grants. And so that's why we're trying to address those cuts in a short-term manner until the Crime Victims Fund gets back up to a healthy level and states begin to receive, including Massachusetts, begin to receive larger awards that were more akin to what we have received in the past. So ARPA offers us a critical opportunity to stabilize victim services in Massachusetts in the interim and allow programs to better manage their funding to ensure that no victim is left unserved during this time. Our request includes enough funding to sustain current victim services to funded programs at FY21 award levels through FY25 and mitigate further cuts as a result of our reduced federal awards. We also want to use this funding to meet a goal that we have committed ourselves to at MOVA, which is to better support culturally specific programming through focused, targeted procurements. The population's disproportionate
Hey everyone, I think Liam had some additional technical assistance, so I can try to pop in where he left off, which is speaking to our request in addition to supporting culturally specific programming. So as we know, the populations disproportionately impacted by COVID are the same communities that are disproportionately impacted by violence. We have been working on our own strategic plan that began implementation this year, which was led by a commitment to ensure that voices, perspectives, and experience of all victims and survivors, including those who have been historically marginalized, have space and conversations about advocacy and enjoy equitable access to high quality services. We know that marginalized populations need culturally specific programming that values diversity, understands racial inequities, and develops services and supports to meet the unique needs of each community. So as a result, amid our overall VOCA reductions, we have prioritized a new grant program that's in the works right now to enhance culturally specific services for victims of crime from communities of color. Eligible entities are community-based programs that are led by and created for the primary purpose of providing culturally specific services to one or more communities of color. So while this is ongoing, because we've been facing the VOCA reductions, there's a smaller amount of money dedicated to the program than we would like to have. So we want to supplement some state funding in that process to expand the program statewide. And the benefit of having a state investment through ARPA allows MOVA to work with programs to provide technical assistance, real-time funding, and ensure success without the administrative barriers required by federal funding. So for example, as any VOCA funded program knows, it is reimbursement based, and a lot of smaller, more grassroots programs don't have the infrastructure to front money and wait for a reimbursement. But with state dollars where that requirement wouldn't be necessary, we can actually put more money in the hands of programs on the front end to ensure success. So that's something that we're looking to supplement with the ARPA funding. And this project would give us the opportunity to do something different with the state funding, and it would address racial disparities that exist for communities of color, and frankly, rethink the way that we're supporting victim services as an agency. So to that end, we've been talking a lot about the VOCA reductions and what our next steps are, obviously trying to figure out what that looks like for every program and identifying any other funding streams, both state or federal, that may make sense to put more money into the hands of programs. And so when ARPA first came forward, we really took an eye at what the parameters of the bill were and if it was a good fit. And a lot of people have been saying that ARPA is this once in a lifetime funding. And we've, certainly we would take money from any funding source that the state wants to provide to mitigate the reductions. But we do think that ARPA provides a really unique opportunity and it's a great fit for this need. Something that we have been highlighting a lot to the legislature is that this request is a one-time funding investment. It's an opportunity for the state to bridge the reductions in our funding over the next 3 years as the Crime Victims Fund is being built back up through the increased deposits and all the changes that were included in the VOCA fix. That's what the legislature is looking to do with this money. It's difficult to say that they would be able to invest that amount of money over the next few years consistently, and that's not what we're looking for. We are confident that the Crime Victims Fund will return to a healthy balance, and we just need this support in the interim to make sure that programs and services are not cut. Liam, welcome back.
Thank you.
Secondly, no problem. Secondly, we already have the infrastructure and the mechanisms for grant administration within our agency, and we don't need to create any new program for the funding to be efficiently spent. COVID certainly shed a light across the state on a lot of areas that could use additional funding, that need more support throughout the state. And I know that there's a desire for a lot of new programs to come forward. Certainly looking forward to what that looks like. But we know that the creation of programs certainly takes a lot of administration and time. And with ARPA being a limited time grant, the fact that we have the ability to get money out the door quickly is certainly a benefit in this process. So we're really looking to highlight that to the legislature as well. We have a timeline that we know that the funding can be used for and across how long. So, our efficiency, I think, is certainly a benefit. And there's, the strong COVID connection. That is one of the biggest pieces of the bill, is to respond to the public health crisis. And I know every single person on this call understands that there has been a huge increase in need across programs for services and access. And how do we rectify that with our reductions in funding? It's something we've been torturing ourselves over the last year or so, trying to figure out, knowing what was coming. And so I think that just fits very cleanly in what the intentions of the bill are. And, the demand for services is there. We know from our own data that our funding served the most amount of victims last year in our agency's history. And we don't anticipate that to be changing anytime soon. We know that the need is going to stay at high levels because we're not back to what we were. And hopefully, in some ways we don't go back to what services traditionally looked like. But we anticipate that this trend is going to continue over the next few years, certainly through the life of the ARPA grant. And the targeted procurement, again, gives us an opportunity to do something different, because it's the same communities that were disproportionately impacted by COVID, as well as in violence in their communities. We think that this aligns closely with another priority of ARPA, which is to address racial inequities. But also it's the opportunity to bring the legislature into something new. And we're excited about that opportunity, and we are moving forward with this project, but we know that if we can get that state investment, that'll only make the program stronger and more successful. And lastly, there's precedent across other states to spend ARPA for victim services. Through our involvement with the National Association of VOCA Assistance Administrators, NAVA, which Liam is actually the president of, we've done a lot of outreach about what states are doing or what they've done already in terms of receiving ARPA funding. We know that some states have already dedicated some in addition to what was included as the set-asides. And there are plenty of other states who are doing exactly what we are asking for, which is trying to mitigate the VOCA reductions. So, you know, every state wants to kind of piggyback on others. No one really wants to be the standalone. And the fact that we know that there's precedent not only within the bill to support victim services, but across other states and some of our, you know, traditional allies certainly helps that case. So just to provide, you know, some additional kind of background of how we ended up here with ARPA feeling like this was a really, really great opportunity to seize upon. So while we've spent a lot of time educating our state lawmakers about VOCA in general, what we're trying to focus on is what happens if we don't get this investment. And so we've been really trying to highlight what's at risk without ARPA, and that clearly trickles down to every representative or senator's district and communities. So Liam, I will loop back to you. I've talked for a while about what we see as at risk without the ARPA funding.
Stephanie, and apologies again. It was one of those moments like when you're on a cell phone call with someone and you talk for a long time and then you realize you've been disconnected and you call them back and you say, well, what did you hear last? So I apologize for jumping off. We are trying to talk about what's at risk, and no one knows this better than you. And I look at the participant list and I see so many leaders from our community, and that's wonderful. And we want to be sure that you have the information that we have to be able to talk about not just how it impacts your program, but the bigger picture. And so just to give you some of those stats, and you don't need to write these down. We have a toolkit of information we're going to give you after this. But just to give you a sense, you know, VOCA funding, as Steph said, in Massachusetts, you know, we support 161 programs, including so many of you on the call. In FY21, through your programs, we served over 96,000 victims in Massachusetts, and that represents the highest number in MOVA's 34 years. In FY21, and it's really important that we talk about this, approximately 72% of our funding to programs was spent on personnel and staffing, which would be in jeopardy as grants are reduced. It's really important in all the conversations I had with senators in DC, and we talked across the street, that this certainly impacts the services to crime victims, but it also impacts people's jobs. You have staff that go to work every day. They depend on that job, and they depend on meeting their mission to help people. And so we want to ensure legislators know that we want to keep people working. It's obviously there's an increased economic hardship for programs if we don't get this funding. We've seen this illustrated through our match waiver process. As you know, VOCA regulations require subrecipients to contribute to the total cost of their funded project by providing not less than 20% of the total project cost, either cash or in kind, right? And we have a match waiver process that allows us to waive that when programs are unable to make that match requirement. You know, MOVA waived in FY21 $2.9 million in match waiver requests among 125 unique programs. Comparing that to SFY20, MOVA waived about 1.6 million among 35 unique programs. This pandemic impacted you all in your ability to get, you know, that unfettered funding or those volunteer services that you used for match. But I also know that impacted your program as a whole because you use that funding from donors, from that's not grants, to really be able to to some of the services that you can't get funding for. And finally, remote and virtual access for victims. Victim service providers experienced increases in program participation after the shift to a virtual setting. Many, if not all, of our agencies intend to indefinitely shift their work to this hybrid service model. So that means, as I talked earlier, that remote and virtual access is going to be a continued service offered to crime victims whenever possible. And so I know that you all are going to be not only looking to hold on to the staff that you have, but looking to hire additional staff to support both of those modes of services. So we are hoping to be able to engage your voices in this process and in talking to our colleagues across at the legislature about the important work you do, of course, on non-VOCA funded time. And of course, VOCA funded staff can't work on VOCA funded time, so we always have to be clear to say that. But I'm going to turn it over to Steph if you want to talk about how folks can get involved.
Sure, thanks, Liam. Yeah, we've provided a lot of information to you, and certainly we'll have follow-up materials. So hopefully nobody is rushing to take notes. But we also wanted to provide some takeaways. So when we close this webinar, there's some action items that programs and individuals can take should they wish to do so. So there are many ways to get involved and show your support for our proposal, which obviously is to avoid significant cuts and put more money in the hands of victim service programs. The Joint Committee on Ways and Means are hosting public hearings on ARPA funding. This is an opportunity to attend and provide oral testimony or simply submit written testimony to the committees, as well as the House Federal Stimulus and Census Oversight Committee. And if you do submit it, we'd love to see it. Please send us a copy if you're willing. But the good news with hosting this webinar today was we got news yesterday that a hearing has been scheduled for next Tuesday, September 21st at 11 a.m. virtually. And the focuses of that hearing are healthcare, mental health, substance use disorders, public health, and human services. And after speaking with committee members, we've identified this to be the appropriate venue for not only us to participate, but if anyone on this call or in your programs or agencies want to either attend and provide oral or submit written testimony. So the deadline to sign up to testify for that hearing is this Friday, September 17th. Brenna just put a link in the chat. Thanks, Brenna, for the form you can fill out. And to be clear, this is to submit oral testimony. So if you need a bit more time and want to submit written testimony after the fact, you can certainly do that as well. And we'll also be sending this information out today on how to register and the details to submit both to this list, but across our mailing list so that everybody is aware that this is happening. So in addition to the public hearings, social media is always a really helpful platform to share information and share support. So, we certainly encourage you to utilize social media and tag your elected officials and members of the legislature on this request. We're going to be monitoring the use of specific hashtags so that we can then share and amplify your messages over our platforms as well to hopefully reach a wider audience. We're going to be planning a social media campaign over the next couple weeks, so please stay tuned for further details on that as well. And to aid in your advocacy efforts, we have prepared a digital toolkit. Within that toolkit, there are details regarding all the information that we've shared today, as well as sample testimony, social media posts, and how to find your elected officials. We can put that in the chat as well. And please feel free to use any of these materials as is. You can modify them and share them widely. Certainly everybody has access to them. If you're having any issues accessing the toolkit or any of the individual links, please let me know. We've been working on some sharing properties and hopefully we have it all set up, but if there's any issues, please let me know because we want to make sure that we can fix that. And in any of these communications, I encourage you to be specific about what the pending cuts would mean for your program and how ARPA could potentially help avoid them. while we're all facing the collective problem of reduced funding and managing the impacts of the pandemic, we know that COVID has impacted communities differently. That can depend on the geography of where you're providing services, the type of service that you're providing, or the very demographics of the victims and survivors that you're working with. So we want to make sure that legislators are widely informed of all these factors to make sure that they're making sound decisions. And of course, as a state agency, we want to speak to the issue as a whole, but there's nothing stronger than your relationships within your own communities and sharing what that could mean. Liam had just mentioned, but I'll say it again, kind of housekeeping as a reminder, VOCA funds and any fully funded VOCA positions may not be used to lobby any government entities, including local, state, or federal policymakers on any time billed to the grant. So thank you for that. And in closing, I would just say, ARPA is something that we're putting a lot of attention on over the next couple months. We're really excited about the potential for this to mitigate the reductions. I know every program, and certainly ourselves, have been really concerned about what's coming and coming July 1 of 2022. And we hope that this is one of those opportunities where we can seize and move forward. But we're going to be working on other policy initiatives over this time as well. So if you are interested in any additional updates to our policy work, we do have a specific listserv that shares information on pending legislation and hearings and events to support that. So Brenna is going to, thank you, Brenna, put the link in the chat for that as well. It's also on our website. So please feel free to sign up for that as well and share it if there's anyone in your agency that may make sense to receive those updates. So thank you. I'll pass it off to Liam for kind of a closing piece, but I just want to say thank you again, and I'm happy to answer any questions along the way specific to the requests, specific to the hearings, or any opportunities to engage. So please feel free to reach out to me at any point.
And I'm going to close out here in a minute, so I invite you, if you do have questions, to put those in the chat. I haven't seen any yet, which means we must have hit all of the high points at least once, if not a few times. And I do want to take a minute to thank Stephanie for leading this effort. She really has done an amazing job. I show up at these things and very incredibly prepared, and she's really been leading us in our efforts on this front. So thank you, Stephanie. And thank you all for showing up today and being part of this. We really want to work with you to achieve this. We said back in April that we knew that these reductions were coming next year, and that we were going to do everything we could to try to find ways to mitigate them. I know I've heard suggestions from you all as to how we can do that. I know many of you are looking at other grants, other funding structures to try to mitigate these cuts. And I really appreciate that. We are in this together, and I hope that you'll let us know if you have questions as to how we can get this through, so we can really bridge this period of time that we have reductions. So unless there's any questions in the chat, which I don't see, I'm going to thank you for your time. We're going to give you 25 minutes back to your day to do whatever. I hope you and your family stay healthy. And as always, thanks for what you do every day to make a difference in people's lives. Take care.